Well, Dr. Shalom Oni is a public health physician, and he joins us here in Lagos. Thank you for joining us on the program.
Thank you very much, Melissa.
All right. I want to start with the NEDC, and that's the commission talking about its donation, PPEs, to health workers, schools, security agencies, to sort of minimize the spread, stamp out the pandemic from the region. But I want us to also look at, the Northeast states and what they've recorded in the last couple of, this is since the pandemic began. If you take a look at the region, that's the Northeast states, Adamawa, Bauchi, Borno, Gombe, Taraba, Yobe.
That's right.
You find out that Gombe, for example, has recorded a lot more cases, over 2,000 compared to the others. Yobe, the least,
Exactly.
with about 499 cases totally since the pandemic broke. But in terms of those that are on admission, Gombe still has the highest. We have Taraba and Yobe states with no cases on admission at the moment. But relatively, we've seen a region with one of the lowest cases in terms of those that have been recorded. What do you think? What do you think this is, and what do you think other regions can learn from the Northeast?
Well, let me respond to the first thing. What we need right now is donations. Donation of face masks, sanitizers, face sheets, all the PPEs. So NEDC bringing donation to the picture, for me, is a step in the right direction. And we need more of the private, and non-governmental organizations to start doing that, because so unfortunately, we are beginning to see the rise, of COVID-19 infection in Nigeria, and it's affecting all the regions, and all the apparatus and structures that were in place in the first and second wave needs to be up and running now. So that's a step in the right direction, and we need more of that.
So do you think that perhaps states relaxed? I mean, if we take a look at Lagos now, that's recording astronomical rise in cases, do you think there was a sort of relaxation
let me say something
after the first and second wave?
You one time used the word fatigue, and I think maybe, for example, myself, I've been wearing face masks for the past 1 year. It's not been easy on a daily basis. So maybe fatigue setting at a point in time, but right now we all need to get our apparatus, up and running to ensure that all the structures are in place. What I mean by line listing, of patients, contact of cases, contact tracing, testing, all those has to, come up so that we can nip this third wave in the bud. But let me go back to the statistics that we have here now. If you look at these states, northeastern states, for me in the last 6 months, something is common to these states, and that's heightened insecurity. I'll be coming from that angle. Now, wherever there's heightened, you look at some of these states, there have been schools shut down, there have been mass exodus, rural urban migration, structures have been, displaced a little. So there have not been a lot of testing going on here. In fact, at the point in time, SCDC alleged that, some of the states, especially in the North Central, we're not sending reports at the right time, to Abuja. So that goes back to the issue of how well has these states been funded, to continue testing, aggressive testing. How well have these states been funded in terms of line listing, in terms of contact tracing, in terms of getting the test done and giving the result back, back to individuals. So these are things we want to look at there. But as far as what to learn is here, it is clear it is yet to be seen, really, because if you are not doing enough testing, what are you going to say? What about structures? How many of them have the isolation centers? That is well equipped. How many of these states, have, the testing centers, the laboratories, just like we have in Lagos. Exactly. So, and if we are not doing enough testing, you will have low figures across board in terms of cases, in terms of admission, in terms of death. It will be across board. So the more you test, now I want to challenge the northeastern state to test as much as Lagos, and let's see what you are going to have at the end of the day. So it's yet to be seen. For me, I think that insecurity thing has played a factor. Then the issue of funding. Nobody's talking about this. To fight pandemic, you need a lot of funds. And the funds need to get to the right set of people. Not at the top, but at the bottom. At the grassroots, the fund need to, because these are the full soldiers that get the job done. Those who are line listing. If you are not mobilizing, they're not funding their transportation, nothing's going to get done. If you are just buying big buses and you're buying all the Jeeps and all your SUVs and you are driving them at the state level, it's not going to do anything. But those who are at the grassroots, who are taking the bike, the motorcycle, taking the forms and the paper, doing the line listing, contact tracing, collecting the samples, these are the people that need the fund. And the fund is not getting to them. Your test is going to be in shambles. And once you're not testing enough, you're not going to have cases, you're not going to have a clearer picture of what you are doing in your state. So for me, that's what I want to leave there for the northeastern state who have experienced heightened insecurity, especially in the last 6 months.
Let's come back to the epicenter as we wrap up. And, Lagos has been that epicenter since, the start of the pandemic. We had the first phase of the COVID-19 vaccinations that started with frontline workers, laboratory staff, and the response team, strategic leaders, amongst others. And we understand that, there might be a new batch coming up in the next few weeks. Moderna, I believe, this was by the Minister of State for Health. Where do you think this should go to? Have we finished that first phase of, vaccinating priority lists? Where do you think we should channel this next batch to?
Well, the next phase of vaccination, it's not, the direction is not clear yet. I don't know what NCDC is going to come up with, but we have not exhausted the list. Not everyone in the first phase have been immunized across board in Nigeria and in Lagos. No. The health workers, the elderlies, the securities, the teachers and all that. No, they have not. So also in the second phase, not everyone has been immunized. So now that we are receiving vaccines and we are about to kick off another phase, I think what is paramount here is that the government needs to look at how many people have received the first dose, who needs to receive the second dose. That should be a priority now. Now, how many people have not yet received in the first and second phase? So I think we need to sort out all these imbalances, before we move to the next phase, the third phase. However, you can take people to the river, but you cannot force them to drink. So there has been some hesitancy as far as taking vaccine is concerned. So if you are not getting enough response from people in first and second phase, then you have to move to the third and fourth. If it is the third and fourth people that are ready, then you go for them. Something to talk about. We always appreciate your time, Dr. Shalamoni, on the program. Thank you so much. You're welcome.